So tell me your question.
So when most people get a trigger finger, it's from like overuse of the MP flexion, of the tendon being adhered that crosses the A1 when they use their A1 pulley repetitively.
Yeah.
So why does it feel better than when you have sponges in between your fingers and still doing the same motion?
Yeah. So that's a great question because a lot of people have this question here. So your A1, so what happens is you have your flexor tendon, right? You have not only the superficialis, but the profundus as well. So both of those tendons go underneath the A1 pulley, right? So you have your tendon, then you have your A1 pulley, and then you have your A2 pulley. Now, what happens is it's not the pulley that gets the knot, it's the tendon sheath that gets that knot, like quote unquote knot. It's like the swelling in a very particular place. And it's in a particular place because every single time you make a fist and open, that inflammation goes down, passes through that pulley system, and then when they go up, when they try to open, it has to pass through it again, right? So it's the tendon sheath that has that knot, quote unquote knot. And what they do is they release that pulley. So they just go in and they release that pulley. So that quote unquote knot or inflammation is still there. The doctors are not going to remove it. Now, the reason why people who have pain is or continue to have pain even after surgery, and the reason why the sponges feel so good is your metacarpal head, right? So here are your metacarpal bones, so this is right here is your metacarpal bone, right? And so you have 1, 2, 3, 4. Now all of those metacarpal bones are held together. You have a lot of like connective tissue that holds it all together. So you have some connective tissue here. Usually those connective tissues are called like a retinacular retinaculum ligaments, and it's like a thin sheath of connective tissue that holds all of the metacarpal heads together. So what happens is when people are having a hard time making a fist, they're using their muscles incorrectly, right? And they're kind of squeezing and holding everything tight. So they've lost a little bit of balance, I feel like, in their hand and how they move. Because in order to make a fist and to open and close it well, your muscles here have to work along with the balance. Your intrinsics have to have a balance with your extrinsics. So in order to curl your eyepiece down, it's all extrinsic, and then to curl this part, it's your intrinsic, and to open, it's your extensors, right? Along with your intrinsics that help with the extension. So they lose a certain balance of it, and so all these little muscles in between the metacarpals, like they get tight, and they're like this. They squeeze. Like if you've ever watched someone make a fist, they're always like squeezing their hands, like their fingers together. Look at all your patients. They're all like, they're trying and they squeeze them all together.
So they're overcompensating using intrinsics.
They're overcompensating, and they've lost that balance in how they're supposed to move. If you can kind of think of it the same way as that when your shoulder patients are like this, and they're like going like that.
That makes sense.
Very, very similar. They've lost the balance because most of the time we're not sitting there thinking, oh, let me use my intrinsics here, and let me use my extrinsic. It's just like you use your hands normally. They just go off by themselves. Now you've lost it. You've got, in a way, you're relearning. Part of it's that, and part of it is all your muscles have gotten really tight. You cannot discount all the lumbricals and all the interossei that squeeze and hold everything together, and then you cut someone here. The key thing is, like, everyone thinks just because you cut like just a pulley system that, oh, it's just a pulley. You didn't cut anything, you didn't break anything. But what does scar tissue do? Scar tissue adheres, and the nature of scar tissue is to like tighten up and pull everything together. And if you've been sitting like this, like we have natural arcs in our hands. So we have one longitudinal, and then we have the way that, you know, it cups here and the way that it cups here. If you've been sitting all day cupping like this, because you're not moving your hand, you're not opening it, you're not stretching everything out. So everything sits like adhered together, and so it's so tight. So just by putting a little bit of sponge, the sponge just naturally separates the metacarpal heads to give it a little extra breathing room. A little extra breathing room. So when they make a fist, it feels so much better. They're like, oh, wow, how did that happen? You know, it's just giving it a little bit of space in between so there's room for movement. Now, I'll use a sponge. Sometimes I'll just use my fingers. And you see me use, I'll just, you know, someone who's having a hard time, I'll put my fingers here and I'll just have them slowly close. And just giving them a little space is just like giving them a little breathing room. You know, sometimes I'll do it here, and then if that feels good, or sometimes I'll do it here and I'll give them a little space up a little bit further. It looks weird because I'm doing it to myself, but yeah, it's just because we have a lot of ligaments that hold everything together. Our ligaments don't just go up and down longitudinal, it goes across too. So we have a lot of structures in the hand, and the muscles are holding everything together. Does that make sense why the sponges really work? Or it doesn't have to be the sponges, but it could be just giving them a little space. And so this stretch alone is helpful. Like they can do, like just put your hands together. They forget, like it's so simple, but
Squeeze, yeah.
you don't have to squeeze. You're just giving your metacarpals a little bit of space. And then you could, you know, you can move your wrists a little bit if you wanted to, but just this act of putting your fingers together is space enough, you know? And then this is why, you know, I'll teach intrinsics this way, stretching the intrinsics, because it's a self stretch. So basically you put your fingers right at your MP, and if you squeeze with a over them,
okay.
Over them, because if you go over them, you're going to bring your MPs into hyperextension, right? Yep, just like that, it's going to give them a little stretch here. So if they're sitting like this all day, you've just now gone, ah. It's just like someone who's like, you know, hunched over, and then you're stretching them out, and they're like, ah. It's the same thing with a hand. Literally the same thing with a hand, right? Same thing. They're all the same. No, I'm kidding. It's not all the same. Is that a good, anything else with the trigger finger? Mm-hmm. Perfect.